been told that your Medicare Advantage plan is leaving the service area. It's being terminated by Medicare. What do you do now? Or someone that you know. Maybe you're on a retiree coverage plan like those with AT&T and Boeing and a whole bunch of others, including some cities and states. And you've been told that your retiree coverage, often a really good plan that resembles, if not is, a Medicare supplement plan paid for by your retiree company, is now being replaced by a Medicare Advantage plan. It's happening all across the country. Well, what do you do? That is the purpose of today's video. So if you know anybody that's being impacted by losing a Medicare Advantage plan or losing their retiree coverage that they were promised their whole entire lives, please stick around and share this information with them. Also, last week there were some hearings in the Senate that echoed exactly what Chris Westphal on that YouTube has been saying. And I think you should see that. So stick around for the end and you'll see what I've been saying coming to real life. All these people saying on the interwebs, oh, you're just biased on one plan versus another. I am biased. I'm biased as all Hades. You know why? Because I hear thousands of stories that I've heard over the last 26 years as to how the rubber meets the road and how these plans actually operate when the worst case scenario comes true. And that's the basis upon which I form my opinions. So we're talking about losing Medicare Advantage. You've been told your plan's leaving the service area. I'll show you a few hundred plans that are happening this time going into 2024. Happens every single year. And we'll talk about that. And then the other one, losing retiree plan for you when they're shoving you into a Medicare Advantage plan. What is it that you need to look for? What are the clues? So let's talk about losing Medicare Advantage. If you're losing your Medicare Advantage plan, you must have been provided a notice along with your annual notice of change, because it's going to be a big one, that you're going to have to do something different for the upcoming year. You can find this at a little part of the Medicare website. It's called the Crosswalked file. It's a huge zip file, computer file that you can download, and you can go in there and you can see all the plans that are terminated for the new year. Let me show you just a few of them. So here are some of the plans that won't be there for next year. And it's all about their plan letter. So some of these are being crosswalked. That's why they call it the Crosswalk file. They're being crosswalked in other plans. So you'd literally have to download the zip file, sort it, as I do in Google Sheets, by if it's being crosswalked or terminated. Then look at all the terminated plans. You'll see hundreds and hundreds of them. A lot of my agent friends were selling this one up here. Lasso, Medicare savings account, one of the last remaining Medicare savings account. It was just this time this year terminated, won't be here next year. So if you had Lasso or any of these other plans specific to the plan numbers, you must pay attention to this. So if you look into Medicare and you ask, what do I do if my plan's been terminated from Medicare? You have two choices. Well, you actually have three. Let's review them. First, you can switch from your Medicare Advantage plan to another Medicare Advantage plan. You can do that 2 months before the end, which would be now, October, November. You can do that for January 1. And since you're in the annual election period anyway, you can do that right up until December 7th and just follow everybody else. But you could also do it 1 month after. So you have all of the month of January to change your plan as well. However, if you don't do it before January starts, you will not have any coverage in January itself. And I put the resources for this, these links down here. I always like to have the actual sources, the receipts as they call them these days. And you can see that in the video description. So what about Medicare supplement? What are my options there to return to original Medicare if you're losing your Medicare Advantage plan? You can do that. So you can find this page. It's when you can buy Medigap. It's a new interactive tool on Medicare.gov. It's pretty cool. So when you click through that, it says, yes, you can buy a Medigap plan 60 days before the end of your Medicare Advantage program ending, and no more than 63 days after your Medicare Advantage plan has already ended. So you can go into February of the next year if you lost your Medicare Advantage plan. Please don't do that. That's a horrible time to wait and have January of no coverage and February of no coverage just back on original Medicare, which subjects you to up to 20% of all the outpatient cost on Part B. So let's look at this. This is your chart of all the Medicare supplement plans out there. If you're losing your Medicare Advantage plan, or this is also triggered, the special enrollment period is triggered if you leave the service area of your Medicare Advantage plan. If you live in Raleigh, North Carolina, you signed up with a Medicare Advantage plan based in Raleigh, North Carolina, and you move to Charleston, South Carolina, this applies to you too. You could either get another Medicare Advantage plan in that new area, or you can get a guaranteed issue Medicare supplement plan. But of all these plan letters up here, you can't get any of them that you want to. You have to get the ones that I've shaded here in this ugly looking yellow. Yes, the ugly looking yellow, these are your choices that you can get. You could get A, B, D, or G. Now, if you were eligible for Medicare for a long time and you had or were eligible for Medicare prior to January 1 of 2020, you've been on Medicare for a long time, then these plans are your guarantee issue go-to plans. Plan C, which did not cover excess charges, or Plan F. Highly don't recommend you doing any guarantee issue plan unless you absolutely have to. But if you were eligible for Medicare after January 1 of 2020, Plan G is pretty much the go-to. This is the guarantee issue plan, which is why I bring up it all the time, that if you can avoid getting on any plan that was guarantee issue or is offered as guarantee issue for tens of thousands of people losing their Medicare Advantage company plan, losing their retiree plan, and they get guarantee issue into a plan, they're shoved into Plan G. Understand that the majority of those people are older than 65 and may have developed, as many do, chronic conditions, chronic diseases, and what that does is it shoots the rates up for everybody that's on the guarantee issue plan. That's why Plan G enjoys rate increases up to 3 to 4 times that of underwritten plans. Plans like Plan N, which is my favorite, which you can only obtain Plan N if you're brand new to Medicare, which is usually the healthiest crowd, or you go through health underwriting. What is health underwriting? I'll explain that to you in just a minute. So most commonly with guarantee issue, this is losing a Medicare Advantage plan. You could get any of these plans, the guarantee issue plans. Now, there is another choice, another option. You could tell your broker, I want to go for Plan N. And that means you go through health underwriting. And I've got a website, a video that explains what underwriting is. And by the end of watching that video, you will probably know whether you could qualify through underwriting or not. But let me just pose you this question. And this is just simple old logic. If there is one plan that they're going to give to everybody, Medicare Advantage, guarantee issue Plan G, they'll give it to everybody based on the insurance lobby making the most money out of you, but I digress. Or there's a plan that you have to qualify for. You have to step up to the plate and show that you are healthy enough for that plan. You really don't show anything. You just answer about 20 health questions. The one that you have to qualify for is generally considered to be, and I know for a fact to be, the better of those choices, because not everyone can get into that plan. You will be in a better risk pool of people who qualified for Plan N. That means your rate increases will be lower across the board. And that theory has been proven true since we've been tracking it since 2016, 17. So those are your options. Either you're losing a Medicare Advantage plan, go to another Medicare Advantage plan, which you can do. You could already do that anytime during the annual election period, which ends December 7th. And again, through another period of time that starts January through March, the disenrollment period or changing period for Medicare Advantage. If you get into January and you find you don't like the Medicare Advantage plan you're on, you can change it again during that period of time. Look at your Medicare and You guidebook, and it'll talk about that period of time. So now let's talk about losing retiree coverage. What do? You're with an AT&T. They promised you as a retiree, you're going to have coverage for the rest of your life. Really? You're with City of New York, tried to do this to the New York public retirees. They fought back. They won. Congratulations. That's awesome. Back to business as usual with them, always still going through the courts with appeals and everything, but they're trying to do the same thing with them. They're trying to shove them into a Medicare Advantage plan because it's better for the payer, the retiree, the company, or the city or the state. Lots of them are doing this. So the question is, do you already have Part B of Medicare? You may be 68, you may be 70, you may be even older, and you've been relying for this whole time on your retiree plan through the city, state, whatever, or big corporation. If you don't have Part B of Medicare started yet, I've got great news for you. You're just like a brand new baby into the world of Medicare. And you can go to a website that I created. This is another kind of a cool website, right? Yesterday, we talked about CaliforniaBirthdayRule.com that explains that and walks through it. And today, HowToStartMedicare.com. So you're going to be starting Medicare, original Medicare, for the first time. If you did not do that yet, and you're leaving a retiree plan, or you choose to do so, 𝗏𝑡ostartmedicare.com will talk to you about how to start Part B of Medicare. When you start Part B of Medicare, the world is now your oyster. Now you can do a variety of things. Make a note of this, 𝗏𝑡ostartmedicare.com. If you've not yet started on Medicare yourself, you're turning 65, or you're going to consider starting Medicare when you're leaving an employer plan later, this has some guidance there as to how to do it, the forms and all that. Once you're brand new to Medicare, you have the two ways to decide on where to go. You can either go to original Medicare, keep it, that's what you've been paying into your whole life, have the freedom of no networks, no hospital restrictions, no prior authorizations, no referrals required to go to any specialist in the country that you want to go to that accepts original Medicare. It's most everybody. You can pick up a Medigap plan, any plan letter you want to, because you're brand new to the Medicare program, no matter what your age is if you're starting Part B. You can also pick up a Part D drug plan, a standalone drug plan custom tailored to what your formulary in the medicine cabinet is. What pharmacy do you use? What are your drugs? Pick a drug plan specifically tailored just for you, and you can use our tool to do that. I'll give you that resource at the end of this video. So you can go to original Medicare, pick up a Medigap plan, feel free to roam the country. Good luck and congratulations, and we can help you with that. All your claims will be automatically approved at Medicare, and if you have a Medigap plan through a thing called crossover, not crosswalking, but crossover, those two things become mirrored together and your claims are paid automatically for you. We can help you with that. The other thing you can do when you're new to Part B is you can join a Medicare Advantage plan. You can go for all the freebies that they advertise. Just please make sure you educate yourself, and they will deny care in many cases. I'll give you some more examples of that in the coming days from this very enlightening Senate hearing that they just had about Medicare Advantage. It'll shock you if you've never seen this kind of stuff before. If you open your eyes and you start looking into it, you'll see it all over the place. So if you want to buy one of those Medicare supplement policies, Medigap policies they call it, then you can sign up for Part B of Medicare with no penalty whatsoever. As long as you've been on a qualifying plan, you're not going to have a penalty when you're starting Part B. What happens if you do have a penalty? Well, for every year past the age of 65 that you did not have a qualifying employee or retiree program, then they could charge you 10% per year in addition to your Part B premium, 10% per year. But if you're leaving an employer-based plan, you're going to be fine there. And again, here are all the Medicare plans, the Medicare supplement plans. And you can get everything from Plan A that nobody buys, Plan B that no one buys, all these other plans. The world is your oyster. If you do want that plan in that I like so much because the rate increases are so much lower and you want to be in a nice risk pool with healthier people across the board, you can do that with no underwriting whatsoever. That period of time when you're new to Part B lasts from the day of your Part B starting 6 months out into the future. You can pick up a Medicare supplement plan. Now, you only have 3 months after that to get a Part D drug plan, so you should do that sooner. We can help you with all that. So when you're leaving the employer coverage, you could get a Medicare supplement plan, as I just mentioned, or this is a page directly from Medicare and you, the Medicare.gov website, or you could get a Medicare Advantage plan. When you're losing your employer coverage or your union coverage, this choice lasts for 2 full months after your coverage ends. And you can pick up a Part D plan, or you can pick up a Medicare Advantage plan. So what if you already have Part B? The world is not your oyster necessarily because you already have Part B. What are your choices then? Well, underwriting is required, but you can still get one of these Medicare supplement plans. You can get any of the plan letters here, but underwriting is required except in certain states which have open enrollment year-round. Like in New York, you drop your plan in the entire state of New York, you can get a Medicare supplement tomorrow. Quick aside here, let me tell you a little bitty secret that most people just don't know. That is, if you live in New York State, and yes, I understand Medicare supplements cost 15 times what they are, in other states, they're just crazy. So if you get one of those fast talking salesmen that shove you into a plan G, but you live in New York State, you're going to pay a small fortune right from the get-go, right from the beginning. What some people have chosen to do is to get high deductible plan G. You should see my high deductible plan G video. I'll try to link it right up there so you can find it. Get high deductible plan G for a monthly premium of $60, $70, $80 a month, depending on what it is there in New York where you are. Then if you get sick, if you get a chronic condition, if you get a chronic ailment, something that you're going to have to live with and live through, you can apply then because it's open enrollment all the time. Hey, I don't make the laws. I just used to say, I don't make the laws. I just enforce them when I was in law enforcement. But I don't make the laws. We just use them, right? They made this loophole. So if you have high deductible Plan G in New York State and you want to switch to Plan G or Plan N or Plan D or any plan you want to, you just make an application. The limitation in the law says one thing. It must start on the 1st of the next month. So if you are in the 26th of the month and you want a Plan G, all the costs, but yes, it's going to be worth it because you're fighting cancer, something else like that, right? With multiple hospital admissions that you see in your foreseeable future, then sign up for Plan G now. It'll be effective on the 1st of next month. Now, if everything goes back into remission, everything calms down, everything's back to normal, go to high deductible Plan G again and save that money. A little aside that the insurance companies for sure don't want you to know. But if you already had Part B of Medicare and you're losing your retiree coverage, you can get a Medicare supplement and pick up a Part D drug plan to go along with it, but you must go through underwriting. Or you can get a Medicare Advantage plan and pick the best one that suits you based on your doctors, your hospitals, and the like. Now, I mentioned that these retiree plans, what they're doing is they're shoving people into their own Medicare Advantage plan. So what do you look for when you're shoved into a Medicare Advantage plan? You need to look at the network limitations. What do they put in front of you? Are referrals required? Is it a small network? Is it a national network? Look at the network. Are your doctors already in that network? If your doctors are not in that network, are they in another Medicare Advantage plans network that may be better fit for you based on who is in the network? Understand the caveat that these networks can and do change all the time. I'm going to show you a video from a senator in just a second talking about ghost networks. And if you look in the book, is everybody in the book actually in the book? No. But also look at coverage restrictions. When is prior authorization required for what conditions, and when is it not required? Prior authorization is the insurance company's way, and this is only a Medicare Advantage phenomenon, where the insurance company can deny you care, delay your care, deny your care, and delay your care. Doctors hate it. Patients hate it, obviously. You'll hear that in just a minute, too, from the Senate Finance Committee. Look at the maximum out of pocket. This is just one factor. I also did a recent video about the max out of pocket and what that really means, what goes towards your max out of pocket. I'll try to link that video in the top of this one so you can find it. It'll also be in the description below. Don't just take them at their word that max out of pocket means everything you're going to spend. It absolutely does not. And then look at the drug cost. Many times retiree offered or employee offered retirement programs have much better drug benefits than the open market does, than the Medicare market does. Many employer plans, and that should be your top consideration, by the way, if you're 65 and over and you're thinking, should I start on Medicare or should I stay in my employer plan? These are the considerations that you should look at as well. How much is it costing you every month? Is it completely no cost to you? Great. Some of our retirees have come to us and said, they're charging me $500 a month for a plan where I have a $6,000 deductible, I have a limitation on my network, et cetera, et cetera. It's horrible. Way worse than the Medicare massive $240 Part B deductible. So look at these considerations, and these are the things to look for. And then the drug cost. There's a big discrepancy between employer offered drug plans versus Part D. The employer ones are often better. You need to compare those two things. Now, wait a minute. In just a second, I'm going to show you the video from the Senate Finance Committee. Will blow your mind, but it's just more of what I've been saying the whole time. And it's more kind of in your face for the insurance agents who always try to comment and purport themselves to be more of an expert on Medicare, saying, you don't know what you're talking about. Medicare Advantage pays for everything that original Medicare pays for, which is a lie from the pit of hell. And you only believe that as long as it takes until you have enough clients that actually get sick, and then they come back with your experience and you're like, oh my God, I've been just shoving Medicare Advantage in the face of seniors, telling them it's a free plan and it's better because it has this perk and the other. That's right. It's the benefit of experience. Anyway, here are some websites that may benefit you. StartPartD.com if you're looking for a standalone drug plan and you're in the annual enrollment period. If you want to look at a Medicare Advantage plan that may be a better fit for you, maybe not, but just look on your own, you can do this website, MedicareAdvantageNearMe.com, 24 hours a day, 365 days a year. But you can only sign up during your initial election period if you're brand new to Medicare, or during the annual election period, which is October 15th through December 7th at midnight, Pearl Harbor Day, my birthday, or during the next period of time, the period between January 1st and March 31st. Any changes that you make during January 1st to March 31st will take effect on the 1st of the next month. If you want to know how underwriting works, if you're not eligible for guarantee issue or open enrollment for a Medicare supplement plan, go to my website here, seniorsavingsnetwork.org/underwritten. Great explanation on how underwriting works, and you can quickly determine for yourself if underwriting is something that you may fit into based on the questions that I have there in that video. And if you want cancer insurance, cancerplan.us. If you have a Medicare Advantage plan of any kind, please look very carefully at your summary of benefits and how much coverage is not there actually for cancer treatment. This is huge, and that's why I put a whole website together, cancerplan.us. Let me show you what happened in the Senate.
Private insurance provides seniors with more options. We need to provide appropriate oversight and protect seniors from deceptive marketing and properly steward taxpayer dollars, and I think that's why we're all here today. I've heard from hospitals across Colorado, like the San Luis Valley Health, about the challenges they face to get their patients timely care with Medicare Advantage plans. Consistently, hospitals and their patients experience hospital admission denials, delays in care, and plans refusing to pay after they've approved a service. In fact, the head of San Luis Valley Health, Connie Martin, told me that in the past 6 months, the hospital has made 45 hospital admissions requests from MA plans, and every single one of them was denied. This is in stark contrast to a 93% approval number across other private non-Medicare plans. This is utterly unacceptable, and I plan to follow up with the plans directly, I have that plan. We have to follow up with the plans, and she was actually quite specific about who the folks were, and I think we're going to have a conversation, but our seniors deserve better than this. Coloradans with Medicare Advantage consistently tell me that that their surgeries are delayed often for months, that they were lied to about their level of coverage or that their plan was too expensive, and that their claims are denied when they're told services, should have been or would have been covered. All of this demonstrates, I think, that we need greater transparency. And so, Ms. Regg, as a director of a state insurance department, do you have access to Medicare Advantage plan denial rates or approval turnaround times? And if you had access to that data, how would that change your ability to guide seniors toward the plan that is best for them and their health care needs?
Going to ask a director of the State Department of Insurance, do you have access to all these denials that Medicare Advantage is doing? Do they provide you with that on the state level? What do you think?
Thank you, Senator. At this current time, no, we do not have access to that level of information. Having access to that detailed information and accuracy rate would greatly help us in choosing plans for consumers and allowing them to have confidence and peace of mind when enrolling into those plans.
Thank you for that answer. And I've got a follow-up question for you, Ms. Regg. Coloradans with Medicare Advantage plans often don't recognize that their private plans don't cover their doctors until it's too late. In 2018, the Centers for Medicare and Medicaid Services reviewed 52 Medicare Advantage plan directories and found that over a third of providers were erroneously included, either because the provider did not work at the listed location or because the provider was out of the plan's network. These are often known as ghost networks. Ghost networks make it difficult for a beneficiary to determine if their doctors are in network at all, and this misinformation often leads to unexpected and higher out-of-pocket costs for Colorado seniors. And that's why I've worked with my colleagues, Senator Ron Wyden and Senator Tom Tillis, to introduce the Real Health Providers Act, which will strengthen requirements for these private Medicare Advantage plans to maintain adequate provider directories. It would also ensure seniors do not pay out-of-network costs for appointments with doctors who were inaccurately listed out of network. Ms. Regg, when you help counsel seniors, as I know you do, how important is it for them to know that their current doctors are actually in the network? And do you feel confident telling them that the provider directories they rely on are accurate.
And network information is vital to choosing a plan. As shared earlier, no, we don't rely on the directory or even the plan finder linked to the company's website page. We use that as a springboard for them to work directly with their provider offices to see if they are in specific Medicare Advantage plans. Network information, not just in network versus out of network, but also knowing if there's a prior authorization to utilize specialists, are hurdles that we often go over with Medicare beneficiaries.
I do think, I'm at an end, so I'm not going to ask my third question. I'll submit it.
Well, I've been saying it for years and been showing proof and proof and proof. And this is as timely as last week. And departments of insurance saying, no, Medicare doesn't provide us any information. We tell people not to rely on the directory provided by Medicare.gov because it's not accurate. But wait, we spent hundreds of millions of dollars on Medicare.gov to be accurate. These insurance companies are supposed to provide accurate information on what doctors are in the network or not. No, we use it as a springboard to tell the senior to call your doctor's office and ask them, are you participating in this network today? Remember, the doctor's contract with the Medicare Advantage plan is an annual contract that's on a different renewal month than your plan. It could renew in February, March, April, May, June, July, or the rest. There are a lot of providers that were once in the network and now they're just not in the network. I had another video I wanted to bring to you. Just the tremendous amount of fallout that's been going on with the script situation in California. It's just so sad. All these people that thought that they were going to have coverage and they just stinking don't. It's just awful. Let me see if I can find that real quick. Nope, I'll bring it in a future video. It's just really sad. But anyway, you need to have somebody that is reliable for you, that you can count on, that's accountable to you. And when you use a broker like these jokers, which is me and my shop, we're licensed in almost all the states in the country. 47, in fact. We're not in Massachusetts or what's the other weird one? Alaska. I'm in Hawaii, but my office is not all licensed in Hawaii, so we don't really do Hawaii. We don't do Guam. We don't do the outer strange isle. We don't do Puerto Rico, for instance. It's just they charge you an arm and a leg to get a license there. Anyway, I digress. More information soon. Hopefully this was helpful. Resources that I mentioned are going to be in the video description. God bless you. Thanks for watching. Please share this with anybody that you know that's trying to find out what to do. Their Medicare Advantage plan is leaving the network, or their retiree coverage is now saying, you must get on a Medicare Advantage plan. Really? You do have options. Thanks so much for watching. Have a great day.